This segment of Delmarva Life is brought to you by TidalHealth.
So, before the break, we learned just how crucial a routine screening can be for one's health. It's how meteorologist Paul Williams found out that he had prostate cancer.
And for women, that's of course why an annual mammogram is so important. And the TidalHealth Breast Center offers comprehensive breast health at one location.
So, this afternoon, we welcome Dr. David Sechler from TidalHealth General Surgery and TidalHealth Breast Center. Thank you so much for joining us.
Thank you for having me.
Good to see you. So, you've got one location. Why is that beneficial?
So we found a few years ago, we established the Breast Center on Snow Hill Road as part of TidalHealth, and our goal was to try to have one place where women could come for their complete care of breast cancer, starting from the beginning all through the end. Starts first with screening, like you mentioned. Mammography is the main way we do screening for women for breast cancer. If an abnormality shows up on a mammogram, we have the ability to transition to further testing with ultrasound as a typical next step. And then from there, if something suspicious is identified, we move to biopsy as to a way to diagnose if there's a problem there. And we have all those capabilities at the Breast Center.
So with the pandemic, statistics are showing that a lot of people kind of delayed their screenings, just the routine screenings. How important is that mammogram?
It's extremely important. You know, if you think of COVID and the pandemic, it's been about 2 years of us going through this whole up and down. And through that 2-year period, a lot of patients did just that. They fell off from getting their routine screenings. We've tracked some of the statistics, and I know nationally it's a big deal. So if someone hadn't had a mammogram in 2 years and now comes in and we see something, unfortunately, a lot of the research is showing that we're going to find things, unfortunately, probably a little bit later stage. So it's vitally important that we get patients back on track and get them back here on their usual annual mammogram screening programs.
So I know it's been a topic of conversation. When do you think a woman should get her first exam?
A woman should definitely start doing screening mammography at age 40. And some exceptions to that, if someone has a family member who was diagnosed with breast cancer at a younger age, say 35, your grandmother or mother had that, then we recommend you should start screening earlier than the age 40. So definitely in that situation, you'd want to start in the mid-30s.
So the TidalHealth Breast Center is accredited by the National Accreditation Program for Breast Centers. How is that earned and why is it important?
Yeah, it's a huge recognition, and we're really proud of that here. It's essentially a recognition of a center of excellence. So as it comes to treatment of breast cancer, the whole process and treatment planning now has become so complex. It involves so many different physicians and providers between medical oncology, radiation oncology, surgery, radiology. And so that program, it ensures that we have that state-of-the-art, all-encompassing care, and we do what's called multidisciplinary review of cases so that we're having the input from each of these specialties up front. And it basically lets us be as good as any other center across the country. We have to be reviewed every 3 years. We have an on-site visit, and they go over all of our data and statistics, and we have to show annually that we're doing as well as the other national centers. So.
Okay, so you were the first general surgeon to perform stereotactic breast biopsies in the Salisbury area. Dumb something down for me. What is a stereotactic breast biopsy?
So we utilize a technique to place a needle to the exact position within the breast that was found on mammogram to identify a piece of tissue that we might have to remove with a needle. And so the stereotactic machine is basically it's a fancy mammogram machine that a computer uses essentially GPS to find that exact spot in the breast.
Okay.
It lines up a motorized needle that guides us and points at the exact location in the breast, and that we help guide it into the position once it's lined up. So that's what stereotactic does. It's allowing us to biopsy spots that we otherwise wouldn't feel. So this is how we're helping find things earlier, exactly. Yeah.
So after you diagnose, as a surgeon, what is your role?
So as a surgeon, focusing on breast disease, breast cancer, our goal and our role is to be that patient's basically coach throughout the entire treatment course, but we also tend to then stay on as their coach moving past treatment. So patients have to be followed. I tell my patients, you and I are buddies for life, because we do. I will see them a minimum of every year as we move out. So someone still needs to be in charge of monitoring when they get their mammograms after treatment, providing breast examinations for them, being a pal, being a coach, being a friend, and that's what I love so much about it, is we really get to be really close as we move forward. So obviously the bigger part is the actual surgery we might do to help remove a tumor from a patient's breast,
Right.
but I think it's way more than that. It's being there beyond that surgery. You're
That
there.
personal connection is huge.
Exactly.
Dr. David Sechler with TidalHealth General Surgery and TidalHealth Breast Center. Thank you so much for talking to us this afternoon.
Appreciate it.